Imagine hearing your heart could explode in your chest. That's exactly what I heard more than 25 years ago. It didn't mean much to me because all I could picture was watching the movie Jaws, and at the end where he exploded, you didn't see that happening on the streets. So I couldn't imagine what that meant. Until a few years later when I saw the soap opera As the World Turns. Dusty Donovan was played by Brian Bloom. He was walking through a yard and sat down next to a tree, and blood started coming out of his ears, his mouth, and his nose. It was later explained that his heart had exploded in his chest. I'm going to educate you on supraventricular tachycardia, or SVT, the symptoms, how it's diagnosed, treated, prevented, and the cure. What I'm going to show you is a normal heart rate, or how a heart beats. The sinoatrial node, when the blood comes into the upper chambers of the heart, will send the electrical impulse down to the AV node. The AV node then separates the electrical impulses down to the ventricles. So the blood comes into the atrium, the blood flows down to the ventricles. When the ventricles contract, the blood goes out to the lungs and the heart, or the rest of the body. What I'd like you to do now is we're going to take our pulse. So if everybody can take their two fingers, their middle finger and their ring finger, and make a straight line down from your thumb to your wrist. And you should feel your heart beating. You feel that?
Yes.
Mm-hmm. Okay, now we're going to time you for 15 seconds. After that 15 seconds, we're going to multiply it by 4, and that'll be your beats per minute. So ready? Go. Stop. Okay, who wants to tell me what their pulse was?
Mine was 92.
92. Normal heart rate is 60 to 90 beats per minute. SVT is an arrhythmia that causes your heart rate to normally last approximately 100 beats a minute, but on average when you have an attack, your heart rate can be up to 240 beats a minute. And that sounds like this. A little bit faster than what you felt, right?
Mm-hmm.
So what that looks like, excuse me, is this. The extra pathway in your heart allows the electrical impulses to get into a loop, which causes your heartbeat to go much faster than what a normal sinus rhythm would be. The chambers aren't able to completely fill with blood, which causes dizziness, lightheadedness, and you're not getting the full blood circulation through your body. There are many causes, and Wolff-Parkinson-White is one that allows that extra electrical impulse to get through the heart, which is noted here. How do you know you have SVT? There are different symptoms that you can experience. They can come on suddenly, and they can go away by themselves. They can last up to a minute or a day or two. The average is around 140 to 250 beats per minute. You can feel palpitations, which is when you feel your heart beating in your chest, dizziness, fainting, shortness of breath, anxiety, and chest pains. In order to determine if these symptoms are in fact SVT, a cardiologist would need to diagnose them through further testing. An electrocardiogram, or an ECG, detects the electrical impulses as they travel through your heart. There are 12 electrodes that are placed on your body and your limbs in order to get different rhythms from different areas of your body. It must be done during an episode, or the ECG will come back normal. That happened to me when we couldn't get to the hospital fast enough, and they kept telling us I was normal, which wasn't the case. So in that situation, a Holter monitor has to be worn, which is a small box like a tape recorder, and it can record you for 24 hours to 48 hours, and it can trace your electrical activity for more than 2 days. Once SVT is diagnosed, there are multiple treatments. There's two options. There's self-treatment or there's emergency medical treatment. In self-treatment, there are a few vagal maneuvers, and vagal maneuvers is when you enact the vagus nerve, which actually changes the chemicals to lower your heart rate and your blood pressure. There's the Valsalva maneuver, which is like when you're bearing down to have a bowel movement, coughing, carotid massage, which is when you feel your heart rate in your neck and massage in a circular pattern. Dipping your head in ice cold water or lying down and just calming yourself and focus your breathing. If you aren't able to stop it on your own and have to have emergency medical treatment, they normally have IV medications such as adenosine. The adenosine actually blocks the electrical impulse from traveling from your sinoatrial node to your AV node, which essentially stops your heart. This is only a few seconds, but it feels like an eternity when you're in it. The side effects are facial flushing, dizziness, chest pain, shortness of breath, and nausea. Although it's successful 90% of the time, it often has to be administered more than once. Then there's also cardioversion, which is when they use the paddles if they're not able to convert it using the IV medications. When you have SVT, there are ways to manage the attacks with maintaining a healthy lifestyle and avoiding stimulation. Some things you can do is you can minimize caffeine intake, avoid cardiac stimulants such as cough suppressants, different medications such as cold remedies and pain medications, lower your cholesterol and lower your sodium, exercise, maintain a healthy weight, and minimize stress. Also avoiding smoking and secondhand smoke, as well as excessive alcohol. Living with SVT, you're constantly in fear of never knowing when an attack is going to happen. So you're afraid of travel, afraid of flying, you don't know when you're going to get stuck away from emergency treatment, and it can cause additional stress. So you just stay in your own home, you don't set goals. The prognosis depends on how often an attack occurs. If you have infrequent episodes, there's minimal risk, and it can lead to a healthy lifestyle. There's a good outcome for those who do need to have IV medications, oral medications. Shit.
Keep going, just keep going.
Keep going, get through this.
Keep going.
Just get through this time.
It can lead to heart failure if it continues and it's untreated due to a weakened heart. A cure is possible for those who do have frequent episodes, but it's aggressive. Radiofrequency ablation is a catheter inserted into your groin. It's threaded to your heart. They induce the rapid heart rate. That allows them to be able to find the additional pathway in your heart. So this is your normal heart rate. They induce the heart rate. That shows where the additional pathway is. The catheter comes in through the groin. It locates the additional pathway, and it burns at that pathway until it's scarred over. That allows the heart rate to go back to a normal sinus rhythm. The first time I had this done, it didn't work. I had to have it done a second time. The second time was successful, and it was more than 15 years ago. I no longer picture my death on a daily basis. I'm less focused on my condition, and I now set some goals, but it's always in the back of my mind that could always return. And here's my crazy family.
Get us off.
Yeah.
Hello.
I didn't see her face. It was always
I didn't know.